Hello everyone. I'm Dr Tarang Krishna from Dr Krishna's Cancer Healer Center. I'm a cancer healer treating cancer patients for almost 2 decades and impacting 5 million lives till date. Well, today's topic is what to do when your doctors tell you that your cancer patient would not survive for more than X number of days or for a couple of months or for 5 months or 6 months. Well, this is absolutely a wrong practice when the doctors tell on the face of a cancer patient that you would not survive for more than a month, for more than 2 months, for more than 6 months. This is absolutely wrong. Nobody can predict anyone's death. The doctors assess the prognosis and the diagnosis based on 3 concepts. Number 1, condition of the patient. So condition of the patient, the doctors assess is through 3 things. By evaluating the reports, by evaluating his physical status, by evaluating his clinical condition, by checking his MRI, PET CT scans, blood reports, histopathology report, CT scans, and all the other parameters that would actually assess what that patient is and how that condition is. Number 2, extension of the disease. Where is the primary source and where exactly has it extended? What are the lymph nodes that has been involved? What are the organs that have been involved? Where exactly the primary source is? Whether it is a lymphoma, whether it is a leukemia, whether it is an osteogenic sarcoma, whether that osteogenic sarcoma is localized in that area, whether it is a pancreatic cancer, and what is that primary source where that chemotherapy, radiotherapy or surgery is possible or not, and what all areas has it covered. So that extension of the disease actually tells a doctor that whether it is operable, whether it would be able to be benefited from chemotherapy or radiotherapy, or whether that condition where radiotherapy can be given into that area or not. Number 3, whether the treatment would be able to reverse the disease process. When the disease is extended into the liver, bones, brain. So whenever there is a brain metastasis, whenever there is liver metastasis, whenever there is bones metastasis, the chemotherapies would never ever would be able to reverse the disease process. So every treatment has its limitation. Even our treatment has certain limitations. So is chemotherapy, so is surgery, so is radiotherapy as well. So you need to understand that whether the treatment would be able to reverse the disease process. If it is a case of an osteogenic sarcoma and they get it operated, उन्होंने वो part remove किया and then it metastasized into the lungs. The moment it gets metastasized into the lungs, they will be able to extend the life, or they will be able to just palliate or suppress the disease, but they will never be able to cure it. The moment the cancer patient enters into a consulting room and doctors assess the reports, and the doctors immediately tell on the face of a cancer patient that you would not survive. This is a critical case. You would not survive for more than 2 months, more than 6 months. I mean, in our cancer centers, we have seen patients who were defined life of probably a month, or probably a couple of days, or probably 1 week, and they have been surviving for years. There have been instances that if you want to check, go to our website. The website is listed out here, and just go to our website and you can see how a cancer patient who was just given number of days numbered, months numbered, just given 2 months to live. And the moment the doctors tell them on their face that you will not survive 2 months, go get your will done, go get your son get married, you are pronouncing a death sentence to a cancer patient and you are asking that patient to be happy. Come on, what kind of practice is this? How come when you are already showing this is the basic fact of life, the moment you tell that you are going to die, all that confidence goes. History has been that your to-do list would never ever get finished even till your last day of your life. Even when you're going onto that grave, your to-do list would never get completed. And still that doctors, I'm really surprised. I'm not saying this against the doctors, but please understand, we need to change this practice. We as doctors have to be strong enough and change this practice of what to communicate to the patient and what to communicate to the attendants. So this is a message which I want to communicate. The attendants of that patient, of that cancer patient, needs to meet the doctors first. And the doctors need to assess and ask, first of all, what is the willpower of the patient? Number 2, what is the basic nature of the patient. You need to understand that basic constitution of a patient. You are asking or you are trying to get that patient treated through a holistic approach or through a modern approach or through a conventional line of treatment. But you need to understand that everybody in this life has a basic nature. They have a tendency of getting angry. They have a tendency to get worried. They have a tendency to get stressed. They have a tendency to lose their willpower. They have a tendency. Some are very strong-willed. Some are great determined. Some are very weak. Some are mentally weak. Some are very gentle, very soft-natured. So you need to understand and you need to make sure that the doctors do not communicate directly to the cancer patient. He needs your willpower, he needs your determination, he needs your support, he needs your guidance, he needs your motivation, and give that to that cancer patient. My humble request to you, don't pronounce it as sentence. Don't say that you just live for a couple of months or just a couple of years. Ask them, motivate them to at least look for other modes of treatment. As a doctor, what's our primary objective? That the patient should survive. As a doctor, what's our primary objective? That the patient should live with a great quality of life, that the patient should have a great longevity of life. So please communicate the right methods to the patient. I hope I've been able to help you out from this video.